Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, Dr. Ashish Jha, who was until June the White House COVID-19 coordinator, joins Public Health on Call to talk with Dr. Josh Sharfstein about what he learned in Washington, D.C., his return to his position as Dean of the Brown University School of Public Health, and what he's worried about with respiratory viruses this fall. If you listen to the end, you'll hear a special connection between the guest and the host in this week's episode. Let's listen.
Dr. Ashish Jha, it is fantastic to see you. Thanks so much for coming on Public Health on Call.
Dr. Josh Sharfstein, I'm delighted to be on. Thanks so much for having me.
So how long has it been since you left your role as the White House COVID coordinator?
It's been a few months. I left in the second half of June. So it's been almost 4 months since I left.
And you're back at Brown School of Public Health?
I am back at the Brown School of Public Health, which is where I was before I went to the White House. Happily back for so many reasons. One was my family was up here, so it's just nice to be back home. But also there was just a lot of things that we had started working on and doing at Brown that I really wanted to continue and drive forward. So I'm excited to be back.
A little bit less security getting to the office?
Little less security. I don't have to go through metal detectors. Never get patted down. Maybe I should get patted down, but I don't get patted down when I walk into my building. It is different.
So I wanted to ask you some questions with the benefit of a couple months hindsight, thinking back on your incredible experience. And first, let me just thank you very much for your service to the country. It's incredibly important and really helped the country move out of the acute phase of the pandemic. But I wonder, as you look back, how you think about that experience and what maybe was a pleasant surprise. And then I'll ask you about a maybe not so pleasant surprise.
Yeah. So starting off on a very personal level, it was just an extraordinary experience. It's unlike anything I have ever done. I suspect it's unlike anything I will ever do. Getting to work in the West Wing of the White House every day, walking in, it gives you goosebumps. It also feels surreal. And the opportunity to really have an impact on what was the biggest public health challenge we have faced in decades also felt like an extraordinary privilege, right? So there was just a lot of things that made it a very, very special moment. And one more kind of maybe minor thing, maybe not, is I've always, in terms of personal identity, thought about the fact that I'm an immigrant. I was born in India. I grew up in India. And so the idea of an immigrant kid who came when I was young to work at the White House adds a different level of surrealness to me. So that's sort of my personal experience of the whole thing. And now, more substantively to your question, the pleasant surprise to me was that there were a series of things I wanted to do from a public health point of view. And actually, even a few months before I went to the White House, I wrote out, in a Washington Post op-ed, here's what needs to happen next in the next phase of the pandemic. I largely got to do those things. I got to work on things that I thought were the important short, medium, and long-term things. It's really important to make sure that we had plenty of testing available and that we had a testing strategy. I thought it was really important that we invest in the next generation of vaccines and treatments. I thought that we had to refill our strategic national stockpile. There was just a set of very concrete things. And never at any point in the White House did I get anybody sort of pushing back and saying, why are we doing this? What's the political benefit of this? Even there was a moment where I remember having a conversation with the president. I was bringing up an idea and I said to him, I think this is the right thing to do from a public health point of view. Now, the politics of this may be complicated. And he said, Doc, because he calls me Doc. He goes, Doc, you worry about the public health part of this. I'll worry about the politics. You're good at public health. I'm pretty good at politics. I said, yes, sir, you are pretty good at the politics. But his point was of course, it's a political organization. I don't think we should be naive. But my job was primarily to think about what's the right answer from a public health perspective. And then we had to figure out how to make it happen. So that was, I think, a huge, very pleasant, very exciting thing to be able to say, oh, yeah, this is what's important. We should figure out how to do it.
What about your experience with the vast federal government? You have the support of people in the White House. The president is listening to you. You've also got a sprawling set of agencies, not to mention the state and local agencies. What did you learn about the government and how did you think that went?
Yeah, it's a great question. So one of the things I did learn that I did not understand, I think, as well as I needed to have, is the White House has a lot of ability to move certain things, but it's ultimately the agencies that get stuff done. And the White House, and the job is, and the official title is the White House COVID-19 Response Coordinator. And it's a lot more coordinating than it is czarring. And people talk about this as the czar. Czars have a lot of power. This is a lot of coordinating. And here are things I learned. I mean, one was there is vast expertise inside agencies. Agencies often come to very different conclusions on complicated questions. I mean, that to me was one of the most interesting things I learned early, was there were really important policy issues where CDC would come out in a slightly different place than CMS, which would come out in a slightly different place than OSHA. And we had to speak as one administration and have one policy. And so a lot of it was about driving to consensus, to a place where maybe nobody loved it was not the perfect answer for anybody, but everybody thought it was a reasonable place to land. The other part was, while there is vast expertise, there is variability. And in almost every agency, it was about finding the right people and making sure their voices were being heard. That I thought was an exercise that took some time and energy, but it was great. And then the last point is, people don't appreciate some of our like civil servants, some of the best people at CDC, some of the best people at FDA. They could be out there making like 10x more money, doing all sorts of things, and they have dedicated their lives to public health. And they get a lot of harassment from the outside of people who don't understand what these agencies do. But I really got to see that up front. This idea of government bureaucracies don't work hard. I mean, the number of 10 p.m. on a Friday night phone calls I had with senior people at FDA or CDC, just a reminder of how hard people work to do these things. And they don't always get appreciated for it.
Well, that is for sure on both counts. I certainly have met so many incredible civil servants in the federal health agencies, and they really are available because that's why they're doing their job.
Yeah, exactly.
And it's also a really important role that you played getting to the point of a decision, because sometimes when you do see splits between agencies or different views coming up, then the default can be to kind of slow down and wait. And what they're waiting for is someone to come in and say a decision needs to be made.
And I realized a lot of times it wasn't they were looking for me to make a decision. Sometimes they were looking for me to make a decision, but a lot of times they were looking for me to help the whole group get to a decision. What it meant for me was less like saying, CDC, you're right, OSHA, you're wrong, or OSHA, you're right, CDC's wrong. But instead saying, here's what's driving CDC's motivation, and here's what's driving OSHA's motivation, and both motivations are really good. And here is like, let's come up with a path for reconciling that. And so often it was about understanding what was underlying the decision-making and disagreements, and then get to consensus. I found most of the times we could get there.
Right. So it wasn't so much making a decision as leading to a decision.
Yeah.
That's great. I want to go back to what I mentioned earlier about unpleasant surprises, things about this role that were difficult, or maybe you had a sense some dynamic would be difficult or some obstacle would be severe. But then when you're there, you really appreciate it.
Yeah. A couple of things come to mind. One is, the 2 years before I went in the pandemic spoke my mind. People just thought he says what he believes. Went to the White House. I actually continued doing the same thing. All of a sudden, people started seeing me, a lot of what I was saying is no longer like, here's a public health guy that we trust saying you should do X, but it was, oh, here's the Biden administration. And I was like, that's the same guy saying the same thing. Like, my messages haven't even changed. But that I found frustrating because all of a sudden, and I guess it may be naive for me to have thought it would be otherwise, but I felt like I was the same guy saying the same stuff. And all of a sudden it started getting seen as much more of a, what's the political angle here? And I was like, there's no political angle. Like, you should just get vaccinated. And by the way, I used to say that 6 months ago, and I still am saying that. So that was frustrating. And I guess a little surprising, though you could argue that I was being naive by being surprised. I should have expected that everything would all of a sudden be seen through the lens of the Biden administration. It did. And then there were other parts of that were interesting in that there were times I thought I was just saying stuff off the cuff because that's just what I think. And then I realized, actually, I'm speaking for the White House and I should not do that. And so it did change like some things of what I could and couldn't say. But most of my messages, I felt like I try to keep them pretty consistent. The other surprising part, Josh, and this was disappointing. There were times when we were trying to get more money from Congress on certain things. I would go up to the Hill and I would meet with a group of bipartisan senators or often Republican senators, members of the House who are Republicans. And, they might come in kind of skeptical on what I had to say. And I would sit down with them for an hour. I remember one very specific conversation, sat down with 4 Republicans and we spent an hour. And at the end of it, one of them said, well, you make a very convincing argument. I said, great. He said, I still can't support it because COVID is so toxic right now that I'm not sure I can support this. And I was like, that to me made me realize that we were just in a difficult moment as a country, that you could get the policy right. You could even convince the policymakers, but the political space for doing the right thing for at least some members of the US Congress just made it very, very difficult. And that was very unfortunate. And that maybe gets me to one more disappointment, not in I would say more in myself. I had tried very hard before I went to the White House to speak to a broad range of audiences. I was doing as much Newsmax as I was doing MSNBC. I had, and again, you could just be like, you're really naive. I had this sense on some key issues, not on everything, that I could departisanize parts of the COVID response, that I could make vaccines a little less partisan, not necessarily less political, but a little less partisan, that I could make treatments. Like, who would have thought treatments for COVID would be partisan? And yet I would see the data pop up and it still looked kind of partisan. And I just was trying everything I could to really push the argument that these are not partisan issues. I will be honest, I feel like I made less progress on that than I wanted and I thought I could. And that was pretty disappointing.
Well, I think we like to think in public health that we're the dog and we can wag our tail. And sometimes the larger forces in society, the polarization is the dog and we're getting wagged.
Yeah. And that may be right.
I want to look ahead for a moment. COVID is not relegated to the dustbin of history, unfortunately. It's still here. It's still making people sick. People are still dying. And you've also got a flu season and an RSV season coming. You've written about the triple-demic. What do you think is critical for people to know heading into the fall of 2023?
Yeah. So I take a step back. And as a clinician, I'm a hospitalist, so I tend to do my clinical work in the hospital and often during the holidays. And I always remind people that before the pandemic, I would show up for a 2-week stint in December or January, and the hospitals would be full. Just like we'd have people parked in the emergency room, all the beds would be full. That respiratory season has always been really hard on American healthcare. And as you know, 30,000 or so Americans die every year of the flu, and probably another 10 or 15,000 die of RSV. And so we've been losing 50,000 people a year. And this is all pre-COVID. And then you throw COVID on top of that. And what you're going to have, and what I have worried about, is our health system's inability to manage all 3 viruses every winter. And it turns out that when you overwhelm the healthcare system with these 3 viruses, the ability of the system to take care of everything else that is necessary also really gets hampered. So that has been increasingly my worry, that we're going to lose a lot of people and that the healthcare system is going to really become dysfunctional. And the good news here is that there's a path out of this. That is not like, let's build hundreds more hospitals and hire tens of thousands of doctors magically and nurses. It really is about making sure that our high-risk people, our elderly, our immunocompromised, chronically ill, all keep up with their vaccines. To me, that is the single most important thing. If we can just do that at high levels, we will save tens of thousands of lives and we will keep our healthcare system functioning. There's a whole lot of other things we should be doing. Obviously, treatments are important. Testing is important. When there are bad outbreaks, asking people to wear masks are important. Indoor air quality. There's a set of things that we need to be investing in as a country. But the number one thing by far is making sure people's immunity is up to date. And that remains to me the number one agenda. And anybody who's sort of pulling us away from that, I think, is doing a lot of harm.
And there are vaccines for each of those threats now.
All 3 for the first time ever, right? We've got COVID vaccines that seem to be working really well against the variants that are out there right now. We've got a good flu vaccine this year. And for the first time ever, we have an RSV vaccine for older people. I think it's really critical that people get them.
Well, I completely agree with that. And I hope that everyone hears this message and makes sure that they are triple covered if they are in the groups that are recommended for all three. I want to ask you one final question. Now, Dr. Jha, you and I went to medical school together.
We did.
And
roommates.
And we were roommates for a period even. And it has just been amazing to me personally to see everything that you have been doing during the pandemic, the huge impact you've had on health. And it makes me reflect on the fact that when we were learning to be doctors, it was about clinical care one patient at a time.
Yep.
And you have had this role now where you had over 300 million patients, in a sense. You had this enormous responsibility at this incredible time in history, like you said. I wonder if you could compare the satisfaction that you can get through clinical medicine with the satisfaction that you can get through public health.
Sure. They are different. And for me, in this pandemic, they've come together in some ways, and I'll try to explain. But clinically, it's very clear, right? Like you walk in, you've got somebody sick, you can either make them better or you can help them navigate this moment. And it's deeply personal and it's very immediate and you feel it. And you walk out of a patient's room feeling like, okay, like we're making progress. In public health, it's a lot harder. And for me, in the beginning of the pandemic, a lot of my public health work was advising governors and state health officials, a little bit advising the White House, who tended not to listen to what I had to say in the early days of the pandemic. But a lot of it was also communicating with the media. Very hard to get a sense of, is anybody listening? Is anything of this making a difference? There are two ways I connect this. I mean, one is over time, especially as lockdowns ended and people started spending more time with each other. I had people come up to me and say, I just found you really helpful. That was that personal satisfaction. I'm like, oh, somebody actually watched this and thought it was useful. That was good. And then occasionally you could actually see policy shift and knew that in the long run it was going to make a difference. But it is much more ephemeral. It feels much more distant. That tangibility that you get from clinical practice is just much harder in public health. But that's okay. Like I always sort of remind people that when you're doing public health, most people who benefit from that public health will never know your name, will never appreciate you. And you got to keep going because you know that's the right thing to do.
Ashish Jha, great to see you. Thanks so much for being here on Public Health On Call.
Sharfstein, thank you for having me here.
Public Health On Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.